Welcome to this edition of A Closer Look. Today we're going to take a closer look at mental health. Here to tell us how to recognize the warning signs associated with suicide and where to get help is Chesapeake Integrated Behavioral Health Care's prevention specialist and clinician, Kristen Martin. Welcome to the show.
Thank you so much for having me. I really appreciate it.
Can you give me some statistics on suicide?
So suicide is actually the 11th leading cause of death in the state of Virginia. But what's even scarier is it's the second leading cause of death between ages of 10 to 34. And in 2020, which we all know is a very difficult year with the COVID pandemic starting, we lost 1,202 people to suicide, which is 1,202 too many. It should be zero. Suicide is definitely a public health problem. Whether you know it or not, it affects us every day in our communities.
And it's preventable for the most part.
Yes, it's completely preventable, yes.
So what are some of the warning signs that someone may be contemplating suicide?
So one thing is that what they're saying, what they're verbally saying to someone, it could be talking about they're being hopeless. They feel like they're a burden to others. They could be talking about how sad they are all the time and they feel like there's no way out. They could be displaying some behaviors, which would be giving away prized possessions. I always say with my coworker when we do these trainings that if you hear me saying I'm giving away my dogs, that's a huge flag for me.
Absolutely.
Yes, because they mean so much to me. It could be behaviors like risky behaviors that they normally wouldn't do, and definitely a big flag would be an increase in drugs or alcohol abuse, because that a lot of times that shows that they're trying to mask the pain and using that as an unhealthy coping skill. And then lastly would be a change in mood. It could be they look more sad than usual, displaying some aggression, some agitation, some irritability, some anxiety, and a lot of times the changes you will notice will be someone that you know. So if I walk into the office and don't tell my coworker Michelle hi, that's a red flag that something is going on and she's going to ask me about it.
So we all experience maybe depression at times, but this is on so much more of a different level.
Yes.
That you would recognize it more or less.
Yes, and being a human's hard a lot of times,
It can be.
especially the last couple years. And we are going to have mental health challenges, like we talked about at our proclamation yesterday. Everyone's going to experience those challenges. It's, do you have the appropriate coping skills? Do you have the support system? Do you have the work-life balance if you work? So a lot of people think that suicide is a very simple problem. Someone takes their life, but it's way more complicated than that. It's a very individual issue, but again, it affects all of us in the community.
Now you mentioned earlier when we were talking about the statistics, 10 years old. That is just so heartbreaking. Has that number new, or has it always been children included in that? And I say that because I know with social media and different aspects of our world today, has that affected that number?
I'm sure it has. We don't have the exact statistics just because a lot of times they can be skewed due to we may not know if it was truly a suicide or an accident, or it could be stigma related to where the family didn't want to say it was suicide, so they wanted to portray it as something else. But of course, we can't deny that the increase in social media and YouTube and Google, it's absolutely terrifying that someone can Google how many pills of this that it will take to end their life versus try to get them high. And they can find stuff like that out on the computer these days.
So what can a parent do if they have concerns about their child?
So I think kind of like you go to a PCP for preventative medicine, it's the same thing with a parent and their child. Have mental health conversations while they're feeling well and make it a normal conversation every day. How was your day? How are you feeling? If they say something, well, how did that make you feel? What's going on? That way, when they are displaying a change in behavior that a parent is concerned about, that child is going to be more likely to want to talk to them about it because it's such a normal part of the conversation. And that way, the teen or youth is going to be more inclined to talk to the parent, and they can create a team effort into trying to figure out how to address the situation.
So we're still dealing with the stigma?
Oh, all the time.
We can't talk about this. This is something we can't talk about. So a lot of it, I guess, is just talking about
Yes.
mental health issues.
Because we have to remember that physical health and mental health are one and the same. Your physical health can affect your mental health can affect your physical health. It's all overall wellness. And it's really important that we remember that when we address one, we address the other. So it needs to be part of everyday conversation. And a lot of times, you know, people still don't want to say the S word. Suicide's a dirty topic. But we want to make it part of everyday conversation because it affects everyone. And it could affect someone that we know, it could affect someone at work, in our family, in our community, in our church group. You just really never know. It's not a certain person who may become suicidal. It could be anybody.
And I know that's a good point because you hear about, like, you know, athletes, you hear about celebrities, and, you know, you always think, wow, how I never saw that coming.
Exactly.
Of course, you know, if I don't know that person, I can say that. But, you know, there may be people who are close who may not know that it's gotten to that drastic point.
You truly never know.
So,
No one's immune to feeling those suicidal thoughts and behaviors. Nobody. It could happen to anybody.
but it's okay to talk about it.
Completely.
That's probably one of the best things you can do is to talk about it.
And you can never start too early. Even with my son, he's 6.5. But for the last couple of years, when we talk about things and we've been through a couple deployments, and that's hard. That's hard on anyone. And so when Corey would ask, well, Mama, you look sad. And I would explain to him. And then when we watch, you know, medical shows on TV, well, Mom, what's going on with their brain? And I explained to him, it's an illness. Your brain is an organ. It's an illness just like everything else. So we have to be able to talk about it. And just to talk about feelings and emotions openly and how to handle them and how to not handle them. And that can never start too early, and it can go a really long way.
And it's okay to feel a certain way.
Of course.
It's not something that you need to feel embarrassed about or bad about.
Exactly.
And that,
We're not
you know,
happy all the time.
No,
It's
we're
just
not.
realistic. We're not always going to be in
Right.
the best mood. We're not always going to have the best day. It's how you process that and how much support you have around you kind of determines where you're going to go. And as soon as someone sees something wrong with someone in their life, talk to them. Talk to them about it. Suicide's not a dirty word. And some people have this myth that if you ask someone about suicide, that, oh my goodness, it's going to make them feel suicidal. That's completely not true. It's been dispelled so many times, but actually asking someone if they're feeling suicidal and using that word will actually bring them a ton of relief. Say, wow, this person's willing to talk about it.
I can imagine. And you're knowing somebody cares enough
To ask you
to ask.
and to notice those
and
behaviors.
They may not be feeling like anyone cares.
Exactly.
So,
And, you know, if they say no, that's not what's on the table, suicide's not what they're thinking about, they know that in the future, if it ever is, that they can come talk to you about it because you were brave enough to ask the question.
that's a really good point. So, can you talk about the Safe Talk training? I know it's
So,
coming up, but
yes.
tell us about that.
So our Safe Talk training is a 3-hour training. Our next training is Tuesday, May 17th from 10 to 1. And that is an evidence-based LivingWorks program curriculum that we use and we teach to the public. And it teaches everyone how to notice signs and symptoms that someone may be experiencing suicidal thoughts and behaviors, and goes through talking to them a little bit about their story and then being able to warmly hand them off to someone who's trained in suicide intervention. It's 3 hours. And it's amazing 3 hours. It's interactive, and we really get you thinking and practicing the skills that we're teaching you in the class.
That sounds like a great program. And if someone can't make it on the 17th, you'll be scheduling
Oh, yes.
another
We will.
one.
Yes, we
So-
actually got 2 of our new staff trained soon, and we'll be able to offer it more to the public.
And where can they go to find more information out about that and other training?
They can go to cibhprevention.com. We have our calendar. You can sign up directly from our calendar for any of our events. We have our newsletter. We have printable resources that you can print out and talk with your family for. We also have a lot of phone numbers and resources available in there. So that's like our one-stop shop to get all the
Okay.
information that you need.
Great information. Thanks, Kristen, for coming by to
course.
talk about this very important topic
Thank
today.
you so much for
I appreciate
having
it.
me.
Well, that does it for this edition of A Closer Look, and we'll see you next time.